All right, welcome everyone to the Power Hour today for SwyftOps in partnership with Navon. My name is Chris Tremp. I'll be taking it through the intro here, but then I will be passing it off to Haley Ben Isaac, who is joining us from Navon to talk about their platform, as well as we'll talk a little bit about the integration and how it works. I'll give you a little bit of a view into how it works with SwyftOps at the end. Just so you know, if you have any questions, we have a chat function here. Just throw them into the chat. If it's something that we can answer right on that spot, we will. If not, we may hold that until the end, where we can open it up for Q&A. You can come off mute and ask any question as well. But don't be shy to throw those questions or comments into the chat as we go along. We'd love to see that. And at this time then, I'm going to hand it off to Haley and let her do her thing. So Haley, thanks for being here. It's all you.
Thank you so much. I'm really happy to be here, Chris, and it's nice to have everybody here in the room with us, and I'm glad we're recording this in case anybody else wants to know what's up and who Navon is and how we can help you to improve your administrative efficiencies with technology. These are all very important hot topics, as we know. So, as promised, I will be talking to you today about how you can leverage an e-learning platform to create administrative efficiencies. You'll also be very, very glad to know I won't be talking to you about industrial design as advertised. I have no idea anything about industrial design. I'll be talking to you about instructional design and how that improves learning retention when we do it in a modern way. And we'll also talk about the best way to communicate and roll out e-learning solutions to ensure high technology adoption. But what's nice about that piece of the conversation is it really applies to any type of technology that you might be thinking about rolling out to your caregivers. So first of all, a lot of you probably don't know who Navon is, and that's okay. I'm here to tell you. So Navon is an education technology in the home and healthcare space. And what we do is we certify caregivers for their mandatory annual in-services or their CEUs. And what differentiates us is our really simple, user-centric, mobile-first approach to caregiver training that uses very simple language that anybody can understand. And we have, oh gosh, it says on the slide over 500 lessons, but I'm very sure it's more than that now because we just released probably about 40 hours of training in the last month or two. And all of our training is available in multiple languages. So English, Spanish, Russian, Haitian Creole, Mandarin, Cantonese. We're launching Arabic soon. Many, many languages that we cover off. So just continuing this talk a little bit about Navon, I want to talk to you about instructional design. We really like to make sure that our caregivers are engaged. So we use in all of our design methodology, the Socratic teaching method. So you guys all know what the Socratic teaching method is. You guys just don't remember that you know this. It's exactly what you've been doing in school since you were kids. So the teacher comes into the class and says, okay, class, we're going to learn about plants today. What do you know about plants? Giving the students an opportunity to demonstrate their knowledge. And the kids all put up their hands and they say, oh, they need water and they need sunshine. And the teacher says, that's right. That process is called photosynthesis. Let's talk about that. And so the teacher expands on the knowledge. So what is in essence happening is the same thing that happens in a classroom, where through our training, we're giving people the opportunity to demonstrate their knowledge and their skills, and we're giving them feedback in real time so that you know that they're getting a quality of information and that it's going in, it's sinking in, and it's all done through these micro lessons. So small bite-sized pieces to make sure that everybody is grasping the content and that they have time to absorb it. So these micro lessons are between 3 and 15 minutes. They allow caregivers to train on their own schedule, like on the bus ride home, for example. The content is available on both mobile app and mobile web, and obviously desktop web, because it's the same website, it's just mobile responsive design. And we're going to make sure we work directly with your team to ensure that the caregivers get onboarded. So that's part of our concierge service. It's very accessible. Also just to a grade 5 literacy level at the most, just between grade 3 and grade 5. And of course, compliance. So we've got built-in tests and quizzes. We're going to meet your precise hourly requirements if your state has them. And we even have an RN available to answer questions if anybody has them. So it's really a full service outsourced training solution that's very, it feels more like an extension of your team. And then of course, getting to this good part, talking about the management panel and how it's integrated with SwyftOps. What's great about the integration is that every time you hire or terminate a caregiver, that caregiver is going to automatically be populated in the Navon management panel. And what that allows for you guys to do is set up some automations with your Navon account manager, and those automations can trigger certain behaviors. So if you bring in a new caregiver, they're hired, they can automatically be enrolled, let's say, in an orientation program. And when they complete the orientation program, they can automatically be enrolled in their first in-service program, starting 30 days from the end of the last program and due on their anniversary date. It is entirely up to you how you customize these automations, but your account manager is there to guide you and actually set those up for you. So you don't even have to be a technical wizard to do this. There's somebody on the Navon team who's there to help you. Chris, do you have anything to add? I know that Chris is actually going to be showing you the SwyftOps side of the integration a little bit later.
Nope, keep going. I'll get that at the end, no worries.
Okay, good stuff. So how do we get people to do this? How do we get people to do the thing that we're asking them to do on technology, no less? Because the thing that I hear most right out of the gate is, oh, my caregivers, they don't know how to use their phones. They don't know how to do technology. They're scared of it. Or maybe they just won't. Okay. I'm here to tell you that's not true. We have hundreds of thousands of caregivers who are using this platform, and we've seen our clients improve technology adoption by over 30% when they are onboarding with Navon, and that's because of the process that we use. But I want to talk to you about internally. So outside of selecting a system that isn't too complex and it's user-friendly, you have to think about internally your priorities and the people who work with you, what their priorities are and how everybody can be of help. So you guys, you're the decision makers, you're setting forth the objectives. And I have a feeling that a lot of you also have to carry out that change just because the size and scale of different businesses. So that's important, but you have a group of coordinators and schedulers who are working with you. And if you incentivize them and make it their priority, they're the people who are on the phone with your caregivers every day, and they can lead the charge and they can affect the change so that they can have their own access into the Navon caregiver training portal, and they can see, oh, Mason's only finished 80% of his training and it's due tomorrow. I'm going to give him a call. His phone number's right there, and they can get Mason to do the training on his phone, and they can connect him with the Navon customer success representative if he's having difficulty. So there's a lot that level of your organization can help you with. When you're talking about how we communicate with people about adopting new technology, you want to think about this flywheel of communication. So there's really 3 different things that we can do. You want to leverage in person, right? So let's say we're starting with a new employee. They've come into your office for orientation, to sign their paperwork, to sign their criminal background check, to submit all of these things. While they're in your office, have them download the Navon app. Have them show you that they have it on their phone. Have them complete a 15-minute sexual harassment training module or elder abuse module while they're in the office with you, so that you can see that they know how to do it and they feel confident when they leave. So that's one way to do it. Of course, you have aides who are already working with you. You're going to get on the phone with them and, remind them that this is how we're doing training now, or this is how we're doing our EVV now, or this is how we're doing remote patient monitoring now, whatever the technology is. And you're going to ask them if they have any questions or concerns about that, and make sure that they leave that phone call knowing what they're doing. Of course, any technology provider like Navon will be able to provide you written formal communication. So, images of how to do the thing that you're asking them to do. So screenshots that can be provided to you. Or you can even put a notice on a pay stub that gets mailed out to them, like just a quick reminder that we're switching our annual training to be online through this provider. Please make sure that your phone is up to date for such and such a date. You want to have formal communication. And then online. So Navon actually helps you with this. We're going to send out text messages to all of the employees to make sure that they're onboarded onto Navon. They know how to access the mobile app. They know how to access technical support. And then we're going to continuously remind them to complete their training through this text message system that we have. And then you want to think, so we've got the who's involved at your side. We've got the means by which you're going to communicate with them. We have to also think about who we're communicating with. So you've got group one, your savvy smartphone users. This is like you and me. Many of these users, as soon as they see that they're doing this, they're going to just download the app and they're going to start using it. It's very easy for them. It's intuitive. Then you have people in this second group. So these are just smartphone users. They're not necessarily savvy. I like to call these, the Carols of the world, because like my mom, her name is Carol, and she is 79 years old and the proud owner of an iPhone. And my mom, Carol, is a little bit afraid of the technology, but she's totally capable and competent and able to use it. So as an example, I got her to be able to change. And first of all, I got her to order her groceries in Instacart. I got her to be able to change between the credit card, my credit card and her credit card, and my address and her address. But how did I do this? I gave her visual references. So when mom calls me up and asks me a question, how do I do this? I don't talk to her about how to do it. I take screenshots and I circle where she needs to click. So this is, one of the ways that you can help support these smartphone users who might not feel so confident, but once they see it, a picture is worth 1,000 words. And then you have these non-mobile app caregivers. So they don't use technology. They have a flip phone. They're totally terrified. And for these people, you might want to have a laptop available in your office and just schedule them to come in and do their training in the office. It's so easy to use that it's not really an issue to get them to do it once they're there. It's just that they need to see it and they want somebody there to be able to ask a question to. So these are the people that we're talking about. So I talked a little bit about this already, but just having training materials available in multiple formats is going to help you to address your caregivers based on their unique learning needs. And providing simple to understand training for technology using interactive online training modules or written materials is really going to help you to gain that traction with the employees that you're looking for. So that's sort of my song and dance as it relates to online training. You're going to forgive me for a second while I just change between my screens here. I want to give you a quick look at Navon. So I'm going to give you a quick tiki tour of our caregiver training platform. So what does it look like from the user perspective? And what does our training look like? So what makes it unique? So I'm starting off here with our web training platform. So our web training platform is obviously available on desktop and mobile web. So I think you guys can see this here, where this is skinnied down a little bit down to a mobile screen size. So this is what it looks like on a mobile phone. And this is what it looks like on a laptop or a desktop computer. I can see here all of my training that's been assigned to me. So caregivers will log in, they'll see what you have assigned to them, not just any random thing. They're not going to scroll through our whole database. Once they come into Navon for the first time, they're going to be able to set their language. So I actually speak Spanish fluently. I do not speak Spanish fluently. That's a lie, but let's pretend that I do. And I come back over here. And when I reload my programs, everything now is in Spanish. So even though I started learning this in English, everything's now translated to Spanish. I come over here and you can see I've finished my first micro lesson. I'm in the middle of my second micro lesson and it has saved my progress. So even though I started this last month, I'm going to pick it up where I left off.
Anotar información sobre el estado y los.
So that's how that works. It saves my progress. I don't have to go back and start again. In order for me to move from one of these micro lessons to another, I'm presented with a lesson quiz. So a single question, if I get it right, it unlocks the next lesson. If I get it wrong, I have to answer a different question instead. And if I get all three of them wrong, then I would just rewatch this little 15-minute or 10-minute lesson. You can also add final quizzes to any of these. And it is at your discretion whether or not you'd like to add a final quiz. So that is sort of the system that the caregiver uses. And of course, I just want to show you one more thing. If they have any questions while they're training, they can go ahead and, type up whatever their question is and send that in to the Navon ticketing system. And we will get back to them, whether it's a customer support agent or a registered nurse, to answer any health related questions, or we can forward those to you if you prefer to field those types of questions yourselves. So that is the caregiver experience. Now, what do they interact with? This is sort of like the icing on the cake. Our training, like I talked to you about, is leveraging the Socratic teaching method. So I'm going to show you what that looks like in real life.
Dietary guidelines for older people.
I hope all of you can hear me and hear this module.
After completing this lesson, you will understand the types of food and nutrients that make up a healthy diet for older people. You will also understand that some medical conditions may require special meal plans or dietary restrictions.
So whenever we do an online training module, we want to make sure that we're putting the lesson objectives up front and we're consistent in how we're delivering those. So every time a new lesson starts, you're going to be presented with lesson objectives. You'll notice how big the fonts are and how big the icons are on the screen. And that's because 95% of the people who are doing online training are doing it on their mobile phone on a screen that's really small. So we use mobile first design principles when we are designing our modules.
Help improve Sue's diet, answer the questions, and avoid making bad food choices along the way.
So our instructional design team, they really shine. They really take a lot of pride in their work, and they like to make the lessons engaging, colorful, friendly sounding, and fun. Anything that you're interacting with on the screen, if it's in a different language, will be translated.
You are at the supermarket with Sue, helping her get groceries. Which type of foods should you get? Drag and drop your answers into the shopping basket.
All right, so let's make a little charcuterie board, shall we? So we're going to get some crusty bread. We're going to get some nice hard and soft cheeses. I'll get some good salami. I want to throw some donuts on there, but everybody knows that donuts do not belong on your charcuterie board, so I can't put them in my basket. They're not very good for you. So I'll get some nice olives and I'll get some, I don't know, berries to put on that board.
There is no one type of food that gives people all the nutrients they need. So to have a healthy diet, it's important to get a wide variety of foods from each of the 5 main food groups. These food groups are generally split into fruits, vegetables, grains, proteins, and dairy or dairy alternatives. Click each one for more information.
So quick review. We introduced the topic by setting our lesson objectives. Then we demonstrated our knowledge by putting the correct food into the basket. And now the teacher is going to expand on that knowledge.
Grains include food like pasta, bread, rice, buckwheat, cereal, and oatmeal. Other starchy foods or foods that are high in carbohydrates, such as potatoes, are also sometimes included in this group. Older people should eat whole grain foods like whole wheat pasta, wholemeal bread, oatmeal, multigrain crackers, and brown rice. As well as being a good source of energy, these foods are full of fiber and vitamins that can improve digestion, lower blood pressure and cholesterol, and help regulate blood sugar. Refined grain foods like cakes, white bread, pastries, and cookies are often low in nutrients and high in added sugar, fat, and sodium, and should be limited.
So we can see now we've expanded our knowledge about grains. That one's checked off, and I have to go through the rest of these before I can move forward. You can't fast forward Navon training. A lot of HHAs in many states need 12 hours, and you have to be able to show that they've done 12 hours and that they've engaged with the training. So it's really designed to be compliant. I won't make you watch the rest of this content here, but I do want to just show you, not that we're going to get into a lot of detail, but you just saw a green screen video. We've got other types of videos within the system. So animated videos are really fun and engaging and help explain concepts that are difficult to explain with just our words. We have task-based instructional videos. So that's how you use a Hoyer lift properly. How do you bend properly to ensure back safety? How do you use a gait belt safely? And those would be filmed where we're zooming in and panning around and getting the details of how to perform the task properly at an appropriate distance so that you can really understand and get a feel for it. And then that Socratic teaching method is leveraged through these games that you're seeing. So you saw a drag and drop game. There are many different styles of games within our system, but all with the same objective, to give people the opportunity to demonstrate their skills and gain feedback. So, I mean, I can show you some examples here. Those are all different kinds of games. One, you click the pigeons and you answer questions. This one is a this or that daily life scenarios for infection control. In this one, you look around a house and you identify areas that have been made safer for someone with dementia. I'll just give you a quick little look at this one because everybody loves it.
Mrs. Gibson's care team and her husband have worked together to make her home as safe for her as possible. Explore her house to see what extra household safety measures have been put in place and discover ways to make dementia clients' homes safer.
So you can go in whatever order you want, but you're not considered completed until you've been into every room. So for our purpose, let's go into the bedroom today.
Find 3 ways Mrs. Gibson's bedroom has been made safer for her.
So Mrs. Gibson's bedroom has been made safer for her in 3 ways. Let's identify those ways. So if I'm looking around here, I notice immediately there's something covering the mirror. So I'll click on that.
Some people with dementia may become distressed or confused if they look in the mirror and don't recognize themselves. To help avoid this, mirrors should be covered or removed. Similarly, it can help to close the curtains or blinds when it gets dark in the evening, so someone with dementia who has trouble recognizing themselves can't see their reflection in the window glass.
Okay. I also noticed that there's this little monitor on the nightstand.
Monitoring devices like those used for babies can help you hear if someone with dementia falls or needs help. This may be particularly helpful for someone with advanced dementia.
And you'll notice there's a big hint button here. So I can't necessarily find the 3rd thing, but when I click this hint button, you can see that the bed is circled.
Big patterns or stripes can be confusing and disorienting for someone with dementia, so it's best to have solid colors or subtle patterns.
All right, so that's an example of a different type of game. And like I said, there's other options where like you get a this or that scenario, and then you get remediation built right in. The remediation is also built right into the tests and quizzes. So all this is wonderful. It's great from the caregiver experience. It's great for you guys to know that your caregivers are getting quality training that's going to help them to prevent hospital readmissions and improve the quality of care to your clients, and therefore have better economic outcomes for your agency. But how do you track all of this? So every time you hire or terminate a caregiver in SwyftOps, those people are going to land here in the Navon Caregiver Training Administrator panel. So this is the thing that you interact with. And once they're in the panel, they can be enrolled in programs. So you can filter your caregivers by, whatever location they're in, the different disciplines that are associated with them, their hire date, any of that information. But you're going to be managing people through programs. So we find many of our clients use semi-annual or quarterly training programs to get people through their annual in-services. Once I select a program, you'll notice it's up here. I can see a lot more detail about what these caregivers are doing and what has already been done. I can see that I have training certificates that I can download right here. So here's a training certificate, and this is what it looks like. So it's got the person's name, their employee number, the name of your training program, how many hours were completed, when you assigned it to them, when they finished it, and a list of all the modules that were covered during that program. And we also have your agency name, the date you signed off on it, and whoever signed off on it. And if your state requires a nurse to sign off on it, we can add their credentials here as well. I can also see people who have finished their training and somebody still needs to sign off on the certificate. So these guys are pending approval. I don't really want to do any filtering. I just want to make this easy. So here we go. I click everybody. If I have the authorization to do this in my agency, I hit actions, I hit approve employees, and only the people who are pending approval come up on my list to confirm. And that's it. That's how you create your training certificates. You don't have to go chasing them down. You don't have to go writing them out. You don't have to physically sign them. You know that they've completed their training, so you can sign off on their training certificate. And then, of course, you want to see anybody who hasn't finished their training. So maybe I want to do a little call campaign. So if I go to the program status and I say that they're in progress and I hit apply, now I have a short list of people who I've assigned to this program but haven't finished it. So I can look over here and I want to see what's up with Mason. Okay, Mason, here's all of his details that I have in the system that have been brought in from SwyftOps. And I can go over here and look at this program. And I can see Mason over here is almost finished his program, but he just hasn't finished his PPE modules, these last 5 lessons that are a sticking point for him. And you can see I've been bugging him for about a year now to finish those last 5 lessons because this is my demo panel. But if I want to, I can send a message individually to Mason through our push message notification system through the Navon mobile app. Or I can send a group of people a message from the other page that I showed you, but those will be a push notification that shows up on their phone. So that's that's over and above the text messages that your Navon account manager will send out. Then, of course, whatever reporting you need to do is accessible here. And you can also see, for your surveyors who come in, you need to be able to show them specifically what you're training on. You have your customized course catalog that's available here. And when you download it, it is customized for your agency with your agency name, the name of the program, the date, a table of contents, your agency name on every footer, and you just go through and you can see all the lessons that are in the program. So that is sort of the quick ticky tour of Navon's caregiver training, and I'm going to pass it back over to Chris.
All right, let me turn my camera back on. All right, thank you, Haley. Appreciate that. And remember, you've got the chat if you want to ask any questions, and we'll do a little Q&A here in a minute. I wanted to show you a little bit of SwyftOps. So number one, how do you sign up for this, or how do you talk to Navon about signing up for this? There's a couple ways. In our knowledge base, there is an article. If you type in Navon, it will find that article, and it has a link inside of it where you can watch a little video about them as well. But right here where it says contact Navon, there's one way, and that'll bring you to a landing page, or in settings, where you actually turn on the integration, this is the same hyperlink. When you click that, or the link right here, it takes you to this web page. This is a co-branded web page. If you fill this out and put your information in, it goes to Navon, and they know that you came from SwyftOps. It is critically important that you contact them through this landing page. Do not go outside of it, because this tells them you came from SwyftOps, and we have made a partnership deal with them, so they'll know exactly that they're talking to a SwyftOps user and about the integration, and be able to discuss their platform with you. So that's how you contact them to then set up a sales call, or just an informational call with them about how it works and if you're interested in that. If you do want to turn it on, then that is where you go. I'll take you back out, settings, and then settings. Now you've signed up with Navon, you would check this box, and they're going to give you a client ID, which is your username basically, and a client secret. These two things come from Navon, and you put those in the box and you save, and you have turned it on. So once that is on, you're able to go to the home screen. Now, it's not on in this demonstration environment, but I can still show you a little bit about what it looks like. You're going to see CG Learning show up here on the top on this dashboard. And we have multiple integrations with e-learning providers. So depending on the one that you have, if you turn on Navon, the one up here for Navon would show up. So let me do that real fast. So when you go into it, you're going to have this area here where you can see different filters. Do I want to look at which caregiver status active, or what? These are the SwyftOps statuses of your caregivers. And this status is the status from Navon. Have they completed? Are they in progress, or have they not started? So just what Haley was showing you on that screen, where you were able to assign courses and track where they're at in their progress, that gets pushed over to SwyftOps. And then obviously you can pull a time frame, or you can just look at specific caregivers. This area here is going to populate just exactly like that information you saw that Haley showed you. So the caregiver's name, what course they're taking, what their status is, what date you assigned it on. Also, all that's being pushed over. So you're doing that work to push it out in Navon. It's syncing over to SwyftOps so you can manage it and see it here. And she was talking about those certificates, and she showed you those certificates of when they completed. Those will come over too, and they will be located under completed on, and there'll be a little icon right here, a little icon of a certificate. And when you click it, you can push that certificate into the caregiver profile. So it marks it in the training area of a caregiver profile that they have completed that course. Okay, so if you didn't know, every caregiver record has a training page. That's always been there. So it will record on this page once you push it through that they've completed it in that certificate. And that's how the integration works. So you would assign those courses, whatever you're pushing out, you can come into SwyftOps and check that progress, mark off the ones that are needing the certificate pushed over, click the button, push it into their profile, be able to manage it right from here. So that's how the sync works. That's really it. Now, on the knowledge base, the Navon article, again, you can watch a little informational video about Navon. I will put this video up from the Power Hour today inside of here as well. And you can, just what I said is exactly listed out here about how the integration works, how to turn it on, and then adding that completed training to the profile. So with that said, are there any questions that either Haley or myself could answer? Let us know, and we'd be happy to answer for you. You can come off mute, or you can use the chat. All right. So we urge all of you to check them out. If you haven't already, conversation costs nothing. There's no obligation there. Caregiver training is crucial. Caregiver retention is crucial. And the more that you're providing to your caregivers for them to be more educated in what they're doing and provide them a support system, which comes with that training, the more likely they are to stay with you in your agency. So you want to be able to have this as a selling point when you're trying to recruit a caregiver, about that they can do these things on the go. You saw the way the content was provided to you. I've seen other content out there with other providers. Everyone does it different. And that's what we really liked about Navon when we first saw it, was the way that the content's provided in a very interactive way, a very easy way to consume it. And even down to the aspect where Haley explained that the text was larger, the font was larger because of the mobile app and being able to see that. These types of things are just little nuances that we thought were just a nice alternative to what we've seen out there in terms of caregiver training in the home care space. So we're happy to have them as partners. I think that you'll really enjoy the platform. They're very supportive partners to work with. I urge all of you to utilize what we have provided for you as an option. And I'm going to send out that link to contact them in the chat, so you have it as well. But remember, it is in the knowledge base article right here, as well as in SwyftOps under your settings. So let me know if there's any questions. If not, we can wrap this up today. I'll give it maybe 15, 20 seconds. Haley, any last words you need to share that perhaps you want to touch on?
No, I'm just excited that I got to see your back end, because I think it's really neat how you guys bring the status of the program directly into SwyftOps to give them that bird's eye view. They don't actually have to come into Navon to monitor that progress, that's a unique feature of SwyftOps. So I'm really excited about it.
Fantastic. We are too. I can't wait. It is out. It is live. It is ready. So if you have any questions, reach out to support. So you can go to our support page, our knowledge base, right? And we always urge people to chat with us. Live chat right here. If you haven't used it, please use it. You can call us as well, or email through the support desk, but chat is the fastest way to get your questions answered. With that said, we'll wrap it up today. I appreciate everyone showing up, and look forward to meeting with you again on the next Power Hour. Thank you, Haley, for the time, and everyone have a great day.
My pleasure. Thanks so much for having me, Chris.